Hello and welcome to the podcast. Today I am talking to Evan Dimentberg, who is a co-founder of Momentum Health. I met Evan at the SOSORT conference this last year, and he was demonstrating some awesome technology with surface topography. And I wanted to get him on the podcast to share what he's been doing because it's pretty cool. And the more I talk to him in this podcast, the more I realize that the technology that he's talking about is something that can really be a game changer for monitoring scoliosis. He talks about surface topography and the technology that they use, as well as the history of Momentum Health and how it came to be. It's a pretty cool story. And he also talks about how Momentum Health and the app that they've developed can be beneficial for patients as well as providers. So if you're a patient or a provider, this is a great episode to listen to if you're looking at monitoring scoliosis progression and doing remote monitoring, which is something we haven't really been able to do for scoliosis. Apologies for the audio. When I recorded this, I didn't realize that my headset was switched to a different headset. So apologize for the audio on my side. Evan's side is fantastic. And hopefully you learn as much as I learned from this podcast episode. I think the technology is something that can go into a lot of different realms, not just scoliosis, and I'm excited to see what it does. So here's Evan Dimentberg and Momentum Health.
Welcome to today's podcast. I'm here with Evan. Evan is with Momentum Health. I met Evan in Boston at the SOSORT conference, and we chatted a little bit about some cool technology that he's using with surface topography. So I wanted to get him on the podcast and just share what's going on with that and how that can benefit you as either a practitioner or people who are diagnosed with scoliosis. So welcome, Evan. Introduce yourself a little bit. Let us get to know you.
Thank you, David, for having me. My name's Evan. I'm one of the co-founders of Momentum Health, and I'm very excited to be here.
Awesome. So give us kind of an idea how your journey with scoliosis started. I mean, this is the Scoliosis Experience podcast, and I'd like to kind of know where the roots of this came from.
So it's actually quite a long and funny story. When we started the company, I was in medical school with a very strong interest in orthopedics and spine. If we flash forward, probably 2018, 2 years before I got into medical school, I did an observation, a 2-week observation with Dr. Jean Ouellette, who's now my co-founder. But back then, really was just to see, do I even like medicine? Is this something I want to go into? Spent 2 weeks with him, scoliosis clinic, scoliosis surgery. And that was really kind of what pushed me into applying to medical school. Then if we go forward again, I was in school. It was the beginning of COVID. There was nothing to do for medical students. We couldn't be in hospitals because of, different regulations and the current situation. And there wasn't a lot of jobs. Everyone was home. So I spent most of my time just reading medical literature, and kind of scoliosis was something I was reading about a lot just because it was something I knew and I had seen, and I was so early in school that I didn't know much. And kind of came across this problem of surface topography and, x-rays being bad for patients, etc. And it got me thinking. I kind of just put a note in my phone, never did anything about it. And then about 6 months later, I found it, started doing more research into it, and ended up putting together a proposal for Dr. Ouellette to say, here is my idea. By the way, do you remember me? And I think we could solve this problem in scoliosis together. Just for the people listening, he's a pediatric spine surgeon at the Montreal Children's Hospital and the Shriners in Montreal. So he was, the go-to guy in Montreal. It just so happened. And he basically answered me saying, hey, nice to hear from you again. You've really hit the nail on the head with the problem. It's exactly something I see in my clinic every day. But your solution is terrible. And at the time, it was terrible. I wanted to develop these magnetic sensors to put on the body and calculate distances.
Pretty complex.
Exactly. And he said, come back to me with a better idea. Brainstorm. So I spent about 3, 4 weeks researching different ideas, imagery. I started playing around with the Apple like Measure app, stuff like that, and came across this technology called photogrammetry, which I had no idea what it even was. Spoke to a guy on Upwork. I found an expert on photogrammetry in South Africa.
Wow.
I had basically just wrote him a message. I said, I'll pay you whatever your hourly rate is, just to answer my questions for an hour. I don't have a project, I don't have a task. I just like need information because I couldn't really understand how it worked. He gave me all the explanations, and I was like, this is, very promising. This seems like it could solve our problem. And at the end of the call, he said, by the way, I have these two friends in the Netherlands who are working with this technology. You should meet them. So I called Dr. Roulette. He loved it, thought it was a great idea. We sat down with these two guys in the Netherlands, and flash forward, we're the four co-founders of Momentum Health.
That's awesome. That is quite the history. I like that he totally shot you down at first.
Yeah, he was very harsh, but it was the right thing to do.
Right. Yeah. Simplify and find the right technology. That's great. Here at my clinic at Align Therapy, we've had the DIRS 4 metric surface topography for almost the last 10 years now. And it's been way valuable in how I treat scoliosis and how I monitor and things like that. So I mean, over 10 years, guaranteed there's got to be better technologies and newer technologies coming out. So it's kind of cool to see that's happening and it's becoming a little more accessible. So
Mhm.
kind of give us an idea of how your system works.
Yeah, so it's a remote monitoring platform. So it's really as simple as a 30 to 45 to 1 minute video, depending on how fast you walk. But really, you have a patient stand still in the middle of a room, doesn't really matter where, it could be at home, it could be in a clinic, and you just walk around them in a circle 3 times, taking this basic video. To you, it looks like you're really just filming the person. So you just want to get as much of the body in as you can. On our end, there's a lot more complicated, the way we kind of look at the frames, etc. But to you, it's just the video. Upload to the cloud, give us a few minutes, and then what we do is we produce a 3D model of the torso. It's photorealistic, true to scale, so we can take all sorts of measurements on it. You can see the 3D model and really kind of compare them over time as well. And then what we do on those 3D models is two things. One is we predict via AI from the outside the Cobb angle on the inside. So the Cobb angle is that gold standard metric for following scoliosis over time. And the second thing we do is we plot surface metrics. So there's a lot of spinal metrics, a lot of asymmetry metrics that you don't need an X-ray to see, right? You can really tell from the outside. So we plot a lot of those as well to really give the clinician as much information that they're used to seeing as possible, and allow them to really do that follow-up just as they would in clinic with an X-ray.
That's pretty cool. And to get into the logistics of it just a little bit, like with the 4 metric, the person can't have anything on from the waist up so that I can see their back.
Mm-hmm.
How involved is it that way?
The thing about surface topography and the thing about our app is the more we see, the better. So for example, if you wanted to take a scan in a full suit and tie, you could, and you would get your 3D model and it would look great. But obviously the predictions and the metrics, etc., would be off because we can't really see the skin. So the principle is the less clothing, the better. The more we see, the more accurate. That being said, we did run studies, which basically showed that for female patients, wearing a sports bra, a tight sports bra, not a large one, actually does not change the accuracy of the app. So that makes it a little easier on patients, we hope. So for females, we basically say bra or no bra, based on comfort, based on who's taking the video at home in clinic. Obviously, that'll change. For males, we suggest shirtless for the most part. And we basically ask that the pants are just lowered a little bit to the waistline, but you can basically be wearing anything from the waist down.
Cool. Yeah, definitely more comfortable for the patient than having to take that off. That's great. You mentioned that it predicts the Cobb angle. How well does this agree with the X-ray?
Yeah, so we have a lot of studies ongoing, both in Canada, the US, and Europe, with a lot of data that's coming out. So when we're looking really at pediatric scoliosis, because we are starting to look at adults as well, pediatric scoliosis, we know that the mean average error, so if we had an X-ray and you had two surgeons measuring the same X-ray, you have an error of about 7 degrees. You have the same surgeon looking at an X-ray in the morning and at night, it's also about 7 degrees. Right now, we're going in at about 6 degrees, 5.96 degrees of our error. So we're very happy with that. We're kind of beating the gold standard already. And as we see more and more data coming in from all these research studies we're doing, that has really been decreasing quite significantly. So we started, about before we launched the app, obviously, but when we started out, we were at the, 9, 10, and it's just been decreasing every month since.
Is that because like AI learning, or it models it better just with the more data that you have?
It's a combination of a lot of factors. Obviously, more data helps, but we do have a lot of data at this point, so it's no longer an issue. But the more data, the better, because we're seeing all different types of curve patterns. What's interesting is that the Cobb angle is a single metric, but a 30-degree curve can look 1,000 different ways, right?
Totally.
30-degree thoracic, lumbar, left, right. Is there a secondary deformity, right? Are they kyphotic? There's all different types of things that can influence the Cobb angle, right? So for us, seeing a couple 30s isn't enough, right? Because there's so many variations that can play into it. So the more data helps, of course, just because, we're getting all these different combinations of deformities, right? We think of the Cobb angle as a 2D metric for a 3D deformity. It's kind of why we don't like it. But at the same time, you've always got to go back to the gold standard and what people are used to. Other reasons is really just improvements in the 3D modeling techniques. So there's the AI side, but also there's a saying, and I'm sorry if this is a bad saying to say on the air, but shit in, shit out. Bad data in, the prediction's going to be bad, right? We really try and clean up the 3D models, and a lot of it is the post-processing. So from the time you take that video till you see that 3D modeling, there's tons of steps in between, and cleaning up that process, giving it the best possible 3D model into the AI as an input is really what helps also give us a great output, right? So really clean data, and that's something that's continuously working on our end.
Right, that makes sense. One thing that I really like about having done surface topography in the clinic for the last 10 years is it gives us more information than that 2D Cobb angle. I mean, we can see rotation, we can see pelvic imbalance and pelvic rotation, obliquity. I mean, all these measurements that as a PT specifically, I want to know as I'm treating them with Schroth method or the C's approach or something like that. And stuff that we don't get from an X-ray.
Yeah, and it's also really, from a medical perspective, when scoliosis gets bad, we're worried, because it's going to compromise the lungs and lung function and et cetera, compromise organs. That's why we operate, right? We operate to kind of save the organs, the lungs, et cetera, on the inside and prevent further medical compromise. For the patients, that's not what they're thinking about, right? Most of them probably never even get that explanation, right? That, this, if you don't treat it, maybe there's a lung problem down the road. Most patients, what they care about, again, this is, I don't have scoliosis, but what we hear all the time is the aesthetics aspect, right? How they look, they feel asymmetrical, maybe they're walking weird, maybe they have some pain, etc. These are the types of things that we can really quantify and give the patient the treatment that's, really going to help them in what they want, not necessarily what the doctor wants to impose on the patient.
Yeah, it's pretty rare that I see a patient come in because of lung or heart function or something like that. It's usually because they don't want to look like they have scoliosis, especially those bigger curves. So that's a great way to utilize it. So one question I get asked with my topography in my clinic is, does it replace an X-ray? So what would you say to someone that's like, oh, I can do this instead of X-ray?
The long story short is no, it does not replace an X-ray. The better answer is that it should replace a lot of X-rays. So let me detail that. Every scoliosis patient needs an X-ray at some point in their care journey. You can never go without any x-rays. The reason being is that there are a lot of causes of scoliosis that are non-idiopathic that have different treatment than the classic AIS, even though it's, 90 something percent of patients. So, a hemivertebra, which is a type of vertebra that's, misshaped, usually a congenital malformation, or different syndromes, some neuromuscular diseases, this scoliosis can be the first sign, and tumors even rarely can cause scoliosis if they're in the spine in a certain place. So these are all reasons that, we need an x-ray, because you can do topography 1,000 times. You'll never catch these with topography, right? So we want to eliminate everything that's non-idiopathic, and because those all have very different treatments. Once we're certain it's idiopathic, we have an x-ray to rule it out, to rule everything else out. Well, now we can be a little more liberal about when we do x-rays and not. Scoliosis is really based on change, as you know, from at least for, in physiotherapy, treatment decisions are a little different than what the surgeons are thinking. But for a surgeon, when they say, there's observation, there's bracing, and then there's surgery, right? Those decisions, that transition is really based on change. Are you getting worse over time, or are you staying the same, right? Right now we do x-rays because there's nothing else, right? We have surgeons all the time that say to us, they say, if only I remembered what the patient looked like 6 months ago, I would have done an x-ray. And, if you go through the phone of a surgeon, they often have hundreds and hundreds of pictures of kids' backs, right? Just so they can do that sort of activity in a way less secure and way less, robust way, let's call it. So how we see our app really playing in is first as a screening tool, right? Right now, patients are screened really with a very subjective physical exam. Often, in some states, it's a nurse that goes into schools. Some states don't have it at all. In Canada, we got rid of it completely, which, has its own problems. So we see it as a screening tool, which just gives an indication of, should you be going for an x-ray or not? But you need that x-ray to confirm your diagnosis at some point. Once you have your confirmed AIS diagnosis, our suggestion is use the platform monthly, every 2 months. It can really depend on, who your clinician is, what they suggest, how likely you are to be progressing, age, stuff like that, skeletal maturity. Use that as really a tool. It's like a triage tool every month to say, are you changing, right? If our app says you're getting worse, that's a reason to go get an x-ray, right? Because you want that confirmation before, you put bracing, or before you say, I'm going to go operate. At the same time, if it says you're not changing, it's actually quite rare that your spine will be getting worse with scoliosis without being able to notice it from the outside, right? There are these visible changes, the rib hump, the shoulder asymmetry, that will get worse. So which is why we really see it as a triage tool to say when you need an x-ray. So if I sum it all up, one x-ray at diagnosis, and then you can use topography, use momentum spine, until it tells you there's change. That's a reason to go get another x-ray and make sure that things are stable.
Awesome. That's right along the lines of how we use topography in the clinic here. It doesn't replace it, but I think we can limit the number of x-rays these kids get, which in the research has shown that they get a significant amount of radiation over time if we just use x-ray to monitor this.
The latest meta-analysis that I've seen showed a 1.5 risk of cancer for scoliosis patients, especially young girls with scoliosis, and a 1.5 times risk of cancer-related mortality in these patients as well, right? So, we don't think about it when we prescribe x-rays, like, oh, it's just an x-ray. But when it's a young boy or girl going through puberty, getting these x-rays every 6 months, even 2 AP lateral x-rays every 6 months,
right,
the consequences are significant, and it's proven to be significant at this point. So it does feel like it's, it should be our responsibility to limit it as much as we can, right?
Yeah, and even we have ultra low dose x-ray technology, but I would say that's still a small percentage of the x-rays that are taken with these kids.
It's really the large hospital centers, the large academic university centers that have it, like the EOS, for example. But there are a lot of places that do not. Yeah, exactly.
Yeah. here in Utah, the EOS was so expensive to maintain, they actually don't even use it anymore. So it's like, it's not even available. When you were talking about neurological scoliosis and hemivertebrae and things like that, in the clinical setting, I see a little bit of a difference in how those curves look. Sometimes with the hemivertebrae, it looks a little sharper. With a Chiari malformation, it's, a little bit different. There are little nuances to those different etiologies of scoliosis. Is there something in the future that you think you might be able to pick up on those? Sure, it would need to be confirmed with an X-ray still, but is there something that your app might be able to flag it?
It's an interesting point. What I would tell you is that for the most part, or actually for all our studies at this point, we've really been focused on AIS because
Right.
it's, the 90+% of patients. And it's really those are the patients that we see having that, that routine monitoring, patients where most do not get worse. So there's really a value proposition of using the app because,
Right.
theoretically 90% of patients could get one X-ray and never be seen again, right?
Yeah.
Because they're not going to get worse over time. We are starting to run studies specifically on other types of scoliosis, such as neuromuscular is one that we're starting to look on as well as adult scoliosis, et cetera. So yes, I think it's definitely within the cards, although I would say it's quite far away. It's not in our immediate priorities at the moment. The thing about the app is that it could be used for a patient with a hemivertebra, for example, right?
Definitely.
It has not been validated on patients with hemivertebra, so use with a grain of caution. But for a physician that's already using, or a clinician, a physio, anyone who's already using the application, right? If you have 100 patients with AIS and you're following them monthly, and you want to follow your hemivertebra patients or your syndromic scoliosis as well, there's no reason not to. Just, you have to keep in mind that the predictions will be off or could be off, but the 3D modeling, the surface metrics we put on, all of that is the exact same, right? So you can use it for visual inspection to see how they're going over time. You can use the surface metrics to see if those are changing over time. You just need to kind of make a note to self when it comes to the predictions.
Yeah, and I think one of the big takeaways is making sure that we have that diagnostic X-ray. I mean, just making sure that imaging that needs to be done to make the diagnosis is done. So I think that's a good point. With this, I mean, you talked about a little bit of research, well, probably a lot of research that's going into supporting what you do. Is there somewhere on your website or something that you guys published the research, or some way people can access that?
So on our website, not at the moment. The reason being is that not actually none of the studies are published yet. The research studies that we've been running are all at least 12 months in duration, if not longer. So many of them are still, that have started and we get data from, and they send us, data all the time. So we have it internally. But the publications, from the time the study finishes and gets out, right? So we're expecting our first two publications, one from France and one from Hôpital Saint-Justine. It's another hospital in Montreal. Those would be our first two publications that should be coming out this fall, actually. I just looked at the papers in the past few weeks, so I know that they're in the process of submitting. And then subsequent ones as of, the winter. But our studies range from 12 all the way up to 36 months, right? So they're quite long because we want to see that long-term follow-up. So yeah, so there will be some coming out. And then once they are, hopefully we'll have something that we could add to our website. We're also looking at doing some case reports with some of the pilots we're starting in different hospitals across the US.
I think that's great. With a new technology like this, we don't expect to have 5 and 10-year studies. We look forward to seeing those. That's going to be awesome.
The goal of those long studies, we're not just trying to replace one X-ray, right? Yeah. We're also trying to show, can we implement early bracing by using the technology, right? Do we pick up curves early enough that, we're bracing them significantly earlier that maybe they're not getting surgery, right? These are the types of, effect sizes that we're confident the app will have. But you got to follow them over a period of years to really see that change over time.
Yeah. Well, that's cool to know that you guys are doing it. So with with someone, let's say in a normal scoliosis treatment program, whether that's including PSSE or that's a regular scoliosis treatment program, how do you feel like your technology fits into that? How can it be utilized the best?
Yeah. So one thing that we often hear is that compliance can be an issue, right?
Mm-hmm. Yeah.
When we look at all these different types of physiotherapy for scoliosis, they're quite demanding for patients, right?
They
We
are,
see
yeah.
that they're good results, right? And it's worthwhile. But for the patient going through it, one, it's hard to see change on your own body, right? It's hard to look at yourself and be like, when it's millimeters difference over time, weekly, right? It's hard to notice that change for the patient, the parent. For the therapist, often it's, you can see it because you're trained to see it, you're used to see it. So I think it's really one is it's kind of like an empowerment tool for patients when it comes to those physio types of exercises. You can really see how you're doing, you can see your improvements, which hopefully will empower them to do more, make them more compliant, et cetera, and kind of cause like a bit of a circle of, I'm doing better, take a scan, do more physio, et cetera. The other way we really see it being used is for the therapist, right? There's Schroth or any of these methods. There's tons of exercises, right? And there's tons of different curve patterns, and different patients have different rigidities, et cetera, different muscles that are stronger. Not every exercise is going to work for every patient, right? You could have one program that works for 10 patients in a row perfectly, and then patient 11, all of a sudden, they're seeing zero improvement, right? So we can also use it as a feedback tool for the therapist to say, is this working? And you can really quantify, is it working? So we'll have therapists, some that use it once a week with their patients, some that in an individual hour will use it before the session, halfway through the session, at the end of the session. Or they'll do just one set of a couple exercises and then do another scan, right? And really quantify, which exercises are working for my patient, which are causing changes or deviations that I want to see. And really, it's a feedback for the therapist to really personalize treatments as well.
That's a really cool idea, actually, like within treatment changes. And because you're right, each of our scoliosis patients are individual. They're different. They have, like you said, one can be very flexible and one can be stiff as a board. It's really a challenge sometimes to do the same Schroth exercises with them. I find myself modifying things. So that can help give us that feedback to modify when needed.
Exactly.
So
they're very demanding and, demanding, intense, et cetera. If it's not working, let's stop as early as we can and change the plan around.
Exactly. It's interesting. This technology is something that's not just for the providers. This can be used at home as well. So kind of give us an idea on what options people have as far as whether they're a provider or they're a patient or how they can get access to this.
Yeah. So, it's you can download it from the App Store on Android or Apple. We do have a list on our website of phones that are compatible with, because if you do have a much older phone, unfortunately, it's based on the camera on your phone and the sensors in your phone. So some older Apple phones, for example, won't have the compatible technology. Basically, most phones that have come out in all phones that have come out in the last, let's say 5-6 years compatible. And then even some older ones as well. Apple, I think it goes back to like the past 7-8 years or something. I don't know exactly off by heart, but there is a list on our website of compatible phones. An easy way to find out if your phone is compatible is just go to the App Store. If you see the app, it's compatible. If you don't see the app, it's not compatible. Right. It's that simple. You can download it. Everyone gets a free trial. So there's 2 weeks free for absolutely anyone. So there's no harm. And you go on, take a scan, see what you think about it, try it out. If you have a clinician, try it out with your clinician, see what they think as well. We see patients, getting the most benefit out of it when they do have a clinician following them, right? For some people, it's a physician. Some people, it's an orthotist. Some people, it's a physiotherapist, chiropractor. Some people, it's a combination of like 10 different specialists that follow them for their scoliosis. What we find is that patients can have difficulty understanding what they're seeing, if it's just the patient on their own, right? So in a screening context, great, download it, test it out, no problem. If it's positive, go see a doctor, go get an x-ray. If it's not, if it's not a screening context, you have scoliosis, it's confirmed, it's great for self-monitoring. And if you're confident and you're able to really look at the data and say, and track how you're getting better or worse over time, well, great. We do find that a lot of patients need that kind of support in understanding what they're seeing, right? Because let's say your Cobb angle changes from 30 to 32, right? What are you going to do with that at home, right? You can see that your 3D models look pretty much the same. Your metrics look pretty much the same, but my 2 degrees worse. Well, you need someone that's going to be able to tell you it's okay. That's normal. That's not an actual change. Don't do anything about it. Don't freak out. It's okay, right? So we also kind of want to. It's always great to have someone to really talk about the data from the app with and kind of contextualize it, right? So it's when you have a team of physiotherapists or a clinic using this application and have patients on it, we see a lot of benefit for that group of patients that are coming to the clinic. When we have a hospital using the app and all their patients are being followed on the app, they're seeing a lot of benefits on it, right? Because you have the security of knowing that when I take a scan, no matter what the outcome is, someone's going to see it on the other end. And if there's a problem, they're going to contact me. They're going to call me. I'm going to be seen. They're going to call me in person, et cetera, right? So you have that kind of that feedback mechanism to make sure everything's okay.
I think that's such a huge point, that topography in and of itself, yeah, you can use it at home and you can monitor yourself, but interpreting what you're looking at sometimes is not that easy without having a background knowledge of what's going on, especially in scoliosis and especially with topography, because it's a different world. So,
and it's relatively new as well, right?
Yeah.
So you need to kind of get used to how to use it, right?
Yeah.
The last thing we want is, a patient who is not being followed, right, to run to the hospital because their treatment went from 30 to 30, from their Cobb angle went from 30 to 32, right? You're going to wait in an ER for hours for absolutely no reason, maybe spend some money on an x-ray that you do not need, right? When you could have just, if you have someone following you, it really helps contextualize the information you're seeing.
Yeah, and I even see some of the surgeons will measure by, 27.5 degrees. And if it goes up by 0.2 degrees, all of a sudden it's like, oh, my curve got worse. Like, that's 0.2 degrees. It's not something we need to worry about. So yeah, contextualize what's going on. That's great.
Mm-hmm.
How can people find out more about this technology? Kind of give us your website, any other ways that they can contact you or find out more.
Yeah, so our website is momentum.health. Quite simple, just the company name with a period between. On our website, there's a contact form. If you fill it out, it actually goes directly to me. So I'll be able to help with anything you need. Also within the app, so if you download the app off the App Store, Momentum Spine, everyone gets a free 2-week trial. Take a scan, try it out. There's a contact section within the app if ever you have questions, comments, concerns. Right through there, we get access. We get all the messages there, and our YouTube channel is another great place. I will probably be sending David. I'll send you some videos as well that maybe we could link in. But on our YouTube channel, there are some videos that really kind of show what taking a scan looks like, how to take a scan, techniques for taking a scan, all the key information you need to get started. It's also present in the app, so you don't have to go to YouTube. But for someone who's kind of considering trying it, it's a good place to go to really see, what the process looks like.
Great. That'll give them some information to try it out. And then hopefully if they're working with a therapist, they can also get the therapist familiar with it as well, or a surgeon, and then just spread the word. Because I think this could be something that we could get better outcomes, and we can also limit x-rays, which I think is fantastic.
Yeah, and hopefully also increase, collaboration between surgeon, physiotherapist, patient, right? It's a team, different medical professionals have their role in the journey, right? Sometimes you need a surgeon, sometimes you need a physio, sometimes you need both, right? If everyone's kind of on the same page, I think it can really help patients get better.
Awesome. Well, I appreciate you talking with me today, Evan, and we look forward to seeing even more technology coming from you guys. That's awesome.
Thank you for having me.